I don't know if you heard me saying that 70% of our healthcare cost is not going to your healthcare. What is the major cost drivers of our healthcare system? Anybody has an idea?
Medical billing, is it?
Say it again?
Medical billing? No?
No.
Licensing.
Inflation.
No. Administration, maybe.
Lawsuit.
Malpractice.
Malpractice.
I have an idea.
Yeah, go ahead, please.
Cost shifting from government plans.
That's true. But the major driver of healthcare cost is the system. The system we have now is a third-party payer system. What means that somebody else is paying the bills. So you're buying insurance, you're paying $300, $400, $500 a month, but that's it. Your cost is fixed, and plus the copays. But on the insurance side, the cost is not fixed. So the system there is no incentive for anybody to control the cost. Now your cost is fixed as a consumer, and you're just only going to pay the copay, and you're going to the doctor saying, "Doctor, this is my problem, what I need." He says, "You need this, 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 this." Okay, do everything. I have my insurance, covers everything. Fine, do it. The doctor says, "Okay, I'll do it because I'm getting paid. It's fee for service." So so there is no incentive to control the cost and the quality as well. So this is the system, and it lends itself to tremendous amounts of abuse, fraudulent activity, and waste. Now, if we drop the system and switch to another system, I'm not advocating any system now, but definitely we can cut the cost by half. This is how much we're wasting money, by half. Will come down to our healthcare cost now is 2.4, 2.5 trillion. They're trying to add another $400–500 billion to cover the uninsured. So we're talking about $3 trillion healthcare cost eventually that's going to be incurred with this system. It can be cut to half easily by changing the system. Now, the second major cost driver. Anybody guessing?
Cost of drugs and medical equipment.
The cost of drugs, that's my last one, actually. Yes. This was the system. The system. It's probably the administration part of that system. You're right.
I was wondering if you could summarize the system before looking at, because in the media, a lot of what they do is they say, "Oh, here's how we should fix it. Here's how we should fix it." But I think it's important to trace how the current system evolved, and what it was like earlier and what it's like now, and a summary of the current system to figure out the problem.
The way we didn't have insurance before, and everybody used to go and pay from their pocket. That's how it used to be in the 50s and 60s. And then the Medicare and Medicaid came in, and then the insurance companies. There were some indemnity plans. They used to be fee for service, but not many people got involved. And then, as Nadine said, when they passed the HMO law, and they mandated to some degree the employers to pay for it, and so somebody start paying for it, and not the consumer paying for it. And some of the consumers, they do buy their own insurance, but most of the insurances are being paid. Now, there's 30% of our population in the United States is covered by the government in form of Medicare, Medicaid, and federal employee health system. This is and the cost of government-run health plans encompasses about 55% of our entire healthcare cost. So they're covering 30% of population and paying 55%. This is the government-run plans. So you expect the government option to come in and then see what happens. And actually the cost of Medicare and Medicaid originally estimated is 9 times now of the original estimates. 9 times higher. So now, and of course everybody started pushing more and more into insurance. They became more powerful, and now we have 85% of the population covered with some sort of insurance. Okay. So this is where the system is. And it's costing us about 2.5 trillion, and it's going to be costing 3 trillion if you include the uninsured people when they get covered. So the second problem that is driving our healthcare costs No, it's preventable diseases. Believe me. Unfortunately, 2/3 of our population is obese or morbidly obese. And they have metabolic syndrome causing them to develop high blood pressure, high cholesterol, diabetes, arthritis, sleep disorders, stasis dermatitis, refractory esophagitis. Heart disease, kidney failure eventually, you name it. And it's eventually all, when they come to fruition, when they become evident, somebody has to treat it. And I see patients all the time on a daily basis for primary care. Okay, this is your problem, let's see if you can lose weight. Very few people do, most of them don't. And we keep adding drugs here, drugs there, and you end up 5, 6, 7 drugs for one person. Now, I'm quite sure in the majority, if they lose that weight, those medications, most of them will be disappearing, so there will be less need for medical care. And of course, we have other contributing factor as well, preventable diseases. We can prevent up to 70% of our medical problems by doing preventive medicine. 70%, really. And that can come easily down to 1/3 of our medical care. That means $800 billion. We're just throwing away constantly by not preventing diseases. And the third major cost drivers. I don't think you're going to be able to guess it, but it's the hospital cost. Now, the hospitals provide 10% of the care for all United States citizens. And we have about 5,000 plus hospitals in this country. They're providing only 10% of the care, but they're taking 40% of the healthcare dollars in. 40%. There's a huge discrepancy, huge. So they're providing little service, essential services. I'm not debating that. But the amount of money they're taking in is 4 times of what they deserve, to be honest with you. And anything that hospital does is costing us 10 times more. I'll give you an example. Now, if we send somebody to have colonoscopy in doctor's office, it costs about $500–600. Same person have the same colonoscopy by the same doctor in the hospital, it will cost $5–6,000. Yes. Now, I can send somebody to have MRI, regular MRI, in an outpatient facility, outside the hospital, radiology facility. It costs about $300. If the same procedure is done in the hospital, it's about $3,000. So, anytime you walk to emergency room, just for a rash, the bill is about $1,000, no matter what. Just walking to the hospital, putting your steps in the ER, is about $1,000 minimum bill. Yeah, there's no question about it. This is how it works. And unfortunately, we should be eliminating outpatient services being provided by the hospital. This is definitely has to be moved outside the hospital and let the doctor make them free to provide the services. Because there is a lot of regulations now by the state that preventing doctors from opening their own centers. Ambulatory surgery centers, you need certificate of need, you need insurance, you need license. The amount of bureaucracy is huge. So that's why the hospital have the monopoly and they can charge whatever they want.